8 o'clock, and the recording has been started for this session. Again, I want to say thank you and good morning to everyone for taking time to join this overview presentation that will be outlining the HL7 general onboarding to our new application, HiSIS. It's for the Hawaii State Immunization System. The HL senders with the links, credentials, and HL7 codes necessary to connect and successfully transmit VXU messages to the new HiSIS system by way of WebIZ. We're having two sessions, this 8 a.m. session and a 1 p.m. session for those who can't make the 8 a.m. If you'd like to also attend the 1 p.m. session, just drop your email in the chat and I can go ahead and send out that invite to you for the 1 p.m. session also. There will be a provider and end user training later in the year, maybe around May of 2025, on the features and functionalities of the system. But for now, we're only targeting our EMR HL7 senders at this time. Again, my name is Gail Watkins. I am a member of the Department of Health Registry Immunization staff as the system analyst and the lead for the onboarding process. This is a team effort, and our entire registry immunization staff are working together to assist all of our point of contacts, EMR senders, with this process. We'll be introducing ourselves to you very shortly and going over the agenda for today. Also on the call should be our Envision vendors, our vendors for the immunization system, Envision, and they will be on the call to assist with any questions that you may have later during our question and answer session. We'll be introducing the members of the Envision team also. And we would like for each one of you to take a moment and introduce yourselves so that we can have an idea who's all on the call. This presentation, again, will be recorded and available for viewing later, so it will be sent out to everyone that's present on the meeting. Now, I'll take this opportunity to introduce ourselves and do the other introductions as mentioned before. Again, my name is Gail Watkins, System Analyst with Department of Health Immunization Registry System. And my role is, of course, lead for the onboarding process. And I am assigned to assist with the following teams. We were able to divide all of the HL7 senders that we were able to identify into groups, and they've been assigned out to the team. So the teams I'm working with, I have two pilot teams, Athena Health, HC Network, and three general onboarding teams, Alliance of Chicago, HHIE, and Physician Computer Company. So next on my team is Jahi. And Jahi, can you please go ahead and introduce yourself?
Hi, good morning, good afternoon. This is Ji-Hye Gu, Program Specialist at Registry Section here. And I'm following up with Cerner Group and Kaiser Group for this onboarding process. Thank you and nice meeting you all.
Thank you. Elizabeth, can you introduce yourself?
Hi, Birding. I'm a program specialist here under Registry, and I will be working with Point and Click, Iron Bridge, Waimanalo Health Center, Waianae Coast, and Wahiawa General. Nice to meet you.
Thank you. Teresa, can you introduce yourself?
Hi, yes, good morning. My name is Teresa Borja. I am the Office Assistant 3 here at Department of Health Immunizations Registry. I answer to Ji-Hye Gu, our Program Specialist 4, and I handle the help desk, and I will be assisting folks from Flatiron Health, Hawaii Health Systems Corp., Hawaii Pacific Health, and Queens Health Systems. Thank you.
Thank you, Teresa. Mac, can you introduce yourself?
Hello, my name is Mac Bautista, and I'm the IT specialist for the innovation branch.
And Mac, you're not coming in clearly.
Oh, okay. Can you hear me?
Oh, that's better. Thank you.
Okay. All right. My apologies. So my name is Mac Bautista, and I'm the IT specialist for the innovation branch. I was assigned to work with eClinical Works and Prescribe Wellness.
Thank
you, and
You're a
I look
little,
forward to working.
you're a little gargled again. Can you announce teams that you're working with?
Oh,
again?
should I repeat this?
Right there.
Okay. So my
That's
name is
perfect.
Mac Bautista, and I'm the IT specialist for the innovation branch. I was assigned to work with eClinical Works and Prescribe Wellness. Thank you, and I look forward to working with you.
All right. Thank you. And Tom, can you introduce yourself, please? Tom, are you on the call? Okay, we'll probably get back to Tom, but Tom is one of the members that is on the call, that's on our team also, and he will be handling, I have to look up what companies he's going to be handling, but then he'll be reaching out to you also. Let me just look real quick to see if I have it on my screen here. He will be working with STC Health, Maui Health Medical Center, Maui Health Systems, Medical Information Engineering, Medical Transcript and Billing. Okay. All right. That's it for our team. If the Envision team is online, we'd like to go ahead and introduce our Envision team. They are our vendors for the Hawaii State Immunization System, and we have been working very closely with them and getting everything prepared and on board for our go live in June of 2025. And we really thank them for everything that they've been doing to assist us in this process. So we'll start off with Shannon. If you're on the line, please go ahead and introduce yourself.
Hello, all. I am Shanna Bryant. I'm a senior project manager with Envision Technology Partners, and I have been overseeing the Hawaii implementation and look forward to continuing to support the Hawaii team as they onboard you all during HL7 onboarding. Thanks, Gail. Maya?
Thank you.
Hi, good morning,
Maya?
everyone. Yeah, thanks. My name is Maya Outerkirk, and I'm an HL7 subject matter expert at Envision Technology Partners. And I'm working with the Hawaii team to onboard you all to their new HiSIS system. So looking forward to working with them and all of you.
Yeah, is Lacey on the line also?
Yeah, good morning, everyone. I'm Lacey Dean. I'm a Senior Client Engagement Manager with Envision Technology Partners, and I will be supporting Hawaii through their implementation and post-go live.
Thank you. Do we have anyone else from the Envision team that's on the line? If not, then we'll go ahead. Oh, I'm sorry. Go ahead.
Nope, I was just going to say that was it. Just the three of us today.
Okay, wonderful. Thank you. And we're glad to have you. So I'll move forward with today's agenda. Our agenda is to go over the step process that we have in place of focusing on the onboarding for our HL7 and EMR senders. Again, this is strictly dealing with looking at setting up your links, your credentials, and giving you the codes that are necessary or the values for the codes in your HL7 VXU messages so that they transfer over successfully to our new system by way of the WebIZ. In January, our step one was a communication to give you notification of the process that is in place. that we're going to be reaching out to you and letting you know that we are doing this onboarding, that we will be having this meeting today. Some of you probably remember receiving this message here. So if you all received this is just letting you know that you're participating in our general onboarding. There were 2 companies, as I mentioned earlier, 2 clinics that was in our pilot onboarding, and I've been working with them. Actually, they are, how can I say, we are a month ahead of the general onboarding. So there's 2 sessions, our pilot and our general onboarding. General onboarding is from February through April, and our pilot onboarding was from January through March. So we're just 1 month ahead. They're a step ahead of you because we're using them as our pilot, and they've been very successful so far in moving forward through the STEP program. And we're looking forward to general onboarding being successful also. So as pointed out, the 3 things that we were requiring, the point of contact for the person who will actually be sending the HL7 VXUs, letting us know that you will be available to attend this session, and also to provide us with a list of your child orgs, because the setup for our onboarding is a little bit different than what you're currently experiencing with our legacy system. With our legacy system, there's a parent and child relationship. With this new onboarding by way of WebIZ, we have the EMR HL7 sender and clinic relationship. So that will be explained as we go forward. But then again, that was step 1 of the communication. In February, where we are now, we're at the point where we're validating the clinics. We want to make sure that we have the list of clinics from each one of your, I know there's multiple clinics underneath your umbrellas for each EMR sender that's sending. Some of them you may send for 1 or 2. Some of them may send for up to 10 to 20 different clinics. But we do need to validate every clinic that you will send an HL7 message for, so we make sure that we have that clinic in our system, that the relationship between the HL7 sender is present, and that when those messages come over, they are directed to the proper patient information data that will be transmitted, and the immunization for that patient is properly transmitted and recorded correctly. So that's our step 2 as to why we're asking you to provide that information. Our step 3, once we have validated your facilities or your clinics, then you'll be provided with the endpoint so that you can start setting up your test environment for transmitting and testing your connectivity. So you'll receive an endpoint link and also the credentials, and that will only be deployed to the point of contact for the HL7 sender. This will not go out to everyone, and that's why we are specifically focusing on the HL7 sender, the person or the entity that will actually be sending and transmitting the VXUs. So right now, that's our focus. Then we're going to discuss this as part of the step 3 communication. You'll receive the HL7 changes that is required in order to send over a successful VXU, and test cases that should be developed. And we'll give a notepad example of what those test cases should look like and the values that should be placed throughout the MSH, the PID, and the RXA statements. Also, we'll be sending along as handouts the SOAP and the WebIZ documentation. So these are the new guidelines that will help you if you need to do any research or have any additional questions about what values should go where, those two documents will definitely provide some additional resources to look up and assist you with that information. The PLC setup WebIC Exchange in the test environment. As I mentioned, we would like for you to go ahead and start setting up your test environment. As of right now, that should point to the Envision Quality Assurance environment. So the endpoint that you will receive, that link, will point to the quality assurance environment that has been set up to receive all of your incoming VXUs. And once those are received, we will be able to go in, analyze those. You will receive acknowledgement responses just as you are receiving now when you send over your HL7 messages. And we can see how well and how successful those messages come over. If there's any errors, we have to analyze that and then repeat the step once corrections are made. So for my pilot people, we have already went through the process of setting up the test cases, and they are at the point now where they're actually ready to send their test cases to the system. And we're looking for that, and that's in their February procedure for our pilot. For our March, that's where the general onboarding group will actually be prepared to send their messages over. You're using February right now to get yourself set up, to prepare. Our staff is reaching out to each one of their assigned clinics or EMRs to set up the process, to communicate with you, to validate your clinics, to provide you with your user IDs and your endpoint. So some of you are still at step 2. Some of you may be at step 3 now, but whatever point you're at, you're right on target in February. We're looking at a range of, as you can see, between January and the latest date would be May 16th. We like to have this testing of the onboarding completed so that if there's any adjustments or things we need to work on, we still have a couple of weeks before the June go live to correct any issues that may occur. So again, in March, you'll actually send over your test cases. They'll be analyzed. We'll check to see if they're in good status. And then we'll be finalizing all of our testing and confirming everything in April and May if there's any issues or things we need to work on during that process. And then at the end of the session, there'll be a Q&A. So I will stop a minute to see if anyone have any questions regarding the agenda or anything that we're going to cover this morning. Okay, if there's no questions, I'll go ahead to the next slide. As mentioned in January step has been completed. The original letter has went out notifying everyone of the onboarding process, letting you know the 3 things that we needed from you, the point of contact, please attending this session or our 1 o'clock session, and then the facility clinic validation. In February, step 2, as we mentioned, assigning a person to work with you with your onboarding process. Oh, sorry. Let me go back. Kind of went too fast for me. Hold on. Let me try this again. Sorry. Click the wrong button here. Okay, thank you. Okay, here we go. Again, many of you are at step 2, or maybe between step 2 and step 3. We have assigned a person to work with the different clinics that are out there. They've reached out to the point of contact that we're aware of. There may be some clinics, if we have not reached out to you at this time, please reach out to us. We do have a ton of email responses that we are still filtering through. So if we haven't gotten back to you yet, please give us a little time. We are working diligently to go through all of the responses to follow up on each one of you and keep you on track according to our scheduling here. Step 3, again, your endpoint will be provided, which is a link that will point you that you need to put into your system or your protocol that you currently have set up, so you can emulate whatever protocol that you currently have set up. As mentioned before, create a new test environment, use the endpoint that's being provided as the link, and then the credentials. So all you need to transmit data is that endpoint and your credentials. Whereas before, you needed to have a parent ID as well as your credentials in order to transmit data. So again, this is set up a little differently so that you don't have that extra layer in there. We're working directly with the clinics and the HL7 user. Now, again, with the immunization, and as I mentioned later, there will be training if there's any manual entry that or manual transmissions that is possible to do also, and you'll train on that a little bit later. But right now for the HL7, we are focused on following this process to get everything on board and to check the transmissions, check your connectivity, and to validate the messages that are being sent over. Again, as noted, with step 3, you'll receive the 2 extra documents. Here's an example of one of the documents. Let me just see if I have that. I had one open, but if not, I'll send it to you when I do have it. We do have, which was provided to us by our vendor, which I just saw, which is very thankful, and I'll share this with you too, our onboarding checklist. So this is also kind of gives you an idea as to the steps that we're taking to prepare to go through the onboarding of the connectivity and to testing. So as I mentioned, you'll get your credentials, you'll get the documentation as well as the link. You'll start preparing your test cases. You'll look at all the changes that needs to be made for the various MSH4, MSH6. You'll test those test cases and we'll see how well they go over, as well as look at your acknowledgments, and we will be analyzing it on our end also. Our testing, our connectivity is very important. We want to make sure that there's no errors, there's no communication errors. We want to make sure that the test comes over successfully and we don't get errors with the VXUs. So we'll be analyzing it on the back end to make sure that that is correct. And we're going to stay in constant communication with you to notify you if there's anything or any issues on our side. And we'll continue that. As I mentioned, we want to do up till May 16th and give ourselves that little 2-week window or so before go live so that everything will be in place. Once we look at the go live, there will be another endpoint that you will receive for the production environment, and that will be handed out or presented to you after the go live. Okay. So the second communication that will be sent out to you, which you'll probably have received already, and this is just a mock-up example of it, but if you haven't received this email already, you will be receiving it, where our staff will be introducing themselves, and they will be notifying you of the onboarding process. If you've already sent your clinics to them, we'll say that we received it. If you have not sent your clinics list in, we'll say we're still waiting on it. We're going to attach a list of the clinics that we have on file for you, and we need you to compare and validate, yes, this is the correct list of clinics. So this is the information that you probably have already received this. If you have not and they haven't introduced themselves yet, believe me, they will be doing this very shortly. Communication 3 is where we go into the details of the clinic, and that will be step 3. And here's where you'll actually receive the endpoint. I'll make this a little bigger. You'll actually receive the endpoint link that will take you to where you need to go to set up your protocol or your environment to do your connectivity. You'll receive your user ID and password in a separate secure email that will follow shortly after receiving this link. Here are the new values that you need to be aware of when you are setting up your VXU. As we mentioned, MSH4, we have different facility codes now. You're using only the clinic numbers, not the parent. So the clinic ID numbers, and then if it's a 4-digit clinic ID number, it will have a preceding 0 to make it a full 5-digit. The HI in front identifies Hawaii so that we know that this is coming to, it's for our Hawaii system, and that will help identify that particular record. The receiving facility is HI again for Hawaii, and it will be all zeros. For the RX11.4, we like for you to have the same value as you're placing in the MSH4. So for an example, and then here are some other things you may be aware of too, or you may be okay with doing. In number 3 of MSH, you can put WebIZ, or you can put your clinic name there if you like. So in the case of Athena Health, instead of putting WebIZ, you can identify yourself or your entity that's sending as the HL7 sender. You can identify yourself there. And as you can see how they have the number here, HiSIS, that's the name of our system. And then here we have the receiving system codes. For MSH10, which is a unique identifier, you can put a date, a facility ID, or the time. It can be a provider-generated number, whatever the choice is, it's the provider's choice. So that's an open option that you can also fill in. For PID 3, that 3, we want to put the MR for medical record or PI for personal identification information. We are asking that if there is an email address for the patient's file, please include that email address in the system, in the VXU message. It's going to be pretty much around PID 13 2-4. We're looking at if there's going to be any opt-out or sharing. If you want to share or not share, yes means that it will be protected. Do not share. A no in position PD 112 means that it will be protected. So that's pretty much the same as we have now. If there's any death or deceased, PID 13 should have a Y. However, if there's a Y in PID 13, you want to make sure that 29 has the date of the deceased. And the race codes, we want to make sure that we're using the correct values for the race codes. So here's the list of the values that is in the current system. Well, our new system, not our legacy system. These are the values that are being used, so we want to make sure that those values are used. And again, this is something that we're asking you to start working with your development team to set up your test environment. And you may want to start looking at preparing your production environment too, and just be ready for the new endpoint link after go live when we send that out to you. So here's an example of a notepad message that's been sent. And as you can see here, I'll make it a little bigger. You can put WebIZ here, or you can put the name of your HL7 sender or your company. So if you're Queens, you want to put Queens. If it's HC Network, you want to put HC Network. But here is the clinic, the ID of the clinic. Again, in position number 5, you want to put HiSIS. Number 6, you're going to put our code for our HiSIS, which is HI is for Hawaii. And in 21, you can put the code again. It's not required, but it's good to have it there. In PID, we mentioned about the medical record. So you can put that there. For the race, this one, for whatever reason, it was 900. But as I mentioned, we have the new race codes. So you want to make sure that you are putting the new race codes as indicated. Here's another example. For the email addresses, we definitely do want to have the email addresses included. And this is a test record, so none of this data here is PII. We definitely want to make sure that we're just using test data. Here is an N in position 29 for not deceased. So you want to definitely, if there was a Y there, then there would be another segment to acquire the date of the deceased. Okay. Here in PD1, you want to make sure you put the N if it's shareable data or Y if it's not shareable data. And then in the RXA, you want to make sure in 11.4, you have the same number for the clinic that you have here in MSH4. So these two definitely must be the same. And that's the most of the major changes. There may be some additional as we move forward, but for the most part, that is the requirements that must be completed. So again, as we move forward and complete all the sending of the DXUs so that we can look at them and test them, we'll spend most of April finalizing the rest of the send. We did ask each point of contact or HL7 sender to pick 5 of your clinics to send tests for. If you don't have 5 clinics that you're sending for, however many you have, up to 5, please send tests for. There are 7 tests for each clinic. So then that would be a total of 35 test cases that you'll actually send over. And we want to have a multiple of them sent over so that we are able to analyze how well the messages are coming in, if they're consistent in their ability to pass successfully without errors. And you can check on your end when you receive your DXUs, your acknowledgments, that you will be able to verify and analyze that your test cases are going through successfully. So here's an example of the test cases that will be requested of you. My 2 pilots have already sent over their test cases, and they have been analyzed. They look good, and we are asking them to actually send the DXUs now. But these are the test cases that we are looking for you to set up throughout the month of February. And then by the time February is over, as of March, then we would like for you to be able to start sending your test cases to us by way of HL7 transmission. So there's 7 test cases. And the last 2 QBPs, you can use test case 1 and test case 2 to, the examples that you're using, the test names and everything you're using to facilitate those last 2 cases. Here, we would like for you for the last name to put the facility name, and then the first name is whatever you want to put, but the facility name would be really good to have put there. And then you can use any address or anything like that. So this is just an example of what we like to see as you prepare your test cases. And once you do have them all prepared, just let us know that you completed setting up your test cases and you're ready to send. And then you should be able to go ahead and send that information over to the HiSIS once you have your environment set up with your credentials and the link. Our go live is June 16th. And as I mentioned then, a new endpoint will be provided after that time for HL7 so that you can send all of your live cases directly to the new production environment. But as right now, we're still working in our quality assurance environment. We want to make sure we get everyone set up and on board properly. And we're going to go through this 5-step process in order to do so. We have 3 months to accomplish this. And based on the survey that we received messages from, the majority of you did respond that you will be able to onboard within a 3-month period. And that's why we kind of stepped this out over course of 3 months to kind of step you along and assist you with the onboarding process. And if there's any problems, reach out to your assigned person to help assist you with any questions, problems, or errors that you may have. So again, we'll be giving you the handout to help you with researching or additional resources of information. Again, end-user training will be provided soon. Again, those dates will probably be in May of this year to learn the new features and functionalities of the system. And you'll have to register for that training. But by the time they get here, we'll have all of the HL7 part set up and ready to go. So then you can just focus on any training for the providers, for the clinics, for the end users, and everyone who will be using the system. It's a great system. We're excited about it. It has some wonderful features, a lot of enhancements than what our current system offer, which is really something to look forward to with this new system. So we're really excited about it, and we're hoping that once we get everyone on board and it's a smooth transition, you'll see how more accommodating the system will be. So we're pretty much to the part now where I'm going to close out of my presentation and open it up for any questions and answers that may be. The last thing I'd like to show you real quick is our website that we will be setting up for the immunization information system. We're announcing our new HiSIS system. You'll be able to go out to this website and acquire more information. You'll be able to go out here and register. This is still in process, so it may not be ready right today, but it should be ready soon so that you can start acquiring more information about the new HiSIS system, register for your training.
Sorry, Gail.
Mm-hmm.
This is GA. I just dropped a link in the chat.
Okay.
So it looks like it's ready
let me
already.
take a look. Is it ready now? Okay, great. Great, because I know we were working on it.
Click on it. It's available.
Oh, cool.
All right.
It's good. Click on it and see. That's good to know because I know we were in the process of working on it. So awesome that it's ready. All right, so then I will go back if there's any questions from anyone about what we covered today, about the 5-step process in order onboarding you by way of HL7 to the new HiSIS system. Again, this is really just focused on our HL7 users, and we want to make sure that we have a smooth transition in helping you on board. So there's 6 of us on the team, and feel free to reach out to me at any time. But then if whoever your assigned onboarding staff person is, definitely reach out to them if you have any questions or anything at all. So we have about 15 minutes left on this session. I'll open it up for any questions from anyone.
Hey, Gail, this is Daryl Crabtree with Ironbridge. I had a question. How are you doing? I have a question about the SOAP credentials. Ironbridge has what I would call like global credentials because we're the electronic transport vendor for a bunch of EHR vendors. So would that remain the same? I guess I can work with the person assigned to us, but would that remain the same, you think, or would that get down to the specifics of the, okay.
Ironbridge will be receiving all new credentials, as all of our HL7 senders will be. So there's new credentials that will be identified because With this being a completely different system and our setup is different, as I mentioned, the HL sender is being associated with the clinics that they will be sending on behalf of. So each
So are you saying that SOAP
HL7
credentials
sender,
are specific to the location?
they are specific to identifying that if you're Iron Bridge, they're specific to the clinics that are associated with Iron Bridge. So whoever you're sending HL7 message for, all of your clinics have been identified underneath that HL7 ID.
Okay, I got you.
Which means these are all the clinics. If you have a list of 10 clinics, that's why we ask for that list of clinics so we can know exactly what clinics you're sending on behalf of. And each one of those clinics are being identified to that HL7 sender profile.
Okay. Gotcha.
And that way, as you send messages over, we know that it's a clean message going over to our system identifying those specific clinics. Whereas before, some things sometimes got convoluted and then messages or immunizations would come over underneath the parent ID instead of underneath the clinic. And we actually want to focus on the facility that administered the vaccine, not so much the parent that that clinic falls under. So yes, all the user IDs will be specific to your clinics, your assigned clinics. Okay, anyone else?
This is Chris from Hilo. I put in the chat about notifying the end users for the end user training. Do you have that current list, or do we need to notify them? How is that going to work when you notify the end users?
No, notifications will go out later in the month. As we mentioned, our end users training will be in May. So notifications will be going out maybe end of April, early part of May to identify the actual training dates and how that process will commence, whether it would be online training, video training, or however they are going to set up. Elizabeth will be in charge of the training, so she will be definitely reaching out to each provider to notify them of how the training will be scheduled. So that will be coming soon. Okay. I see Akash, you have your hand up. Akash, am I saying that correctly? You have your hand up? Are you there? Are you talking on mute maybe? Can you hear me okay, Akash? Okay, I do see another question in the chat. Will we receive recording of this session? Yes, the recordings will be distributed to everyone who's on the call, so I will make that available to you. Maybe not immediately after this call, but before noon. I'll put it that way. Is that okay? It's currently 8:49 a.m. here, so it will be noon. Okay, I see another question in the chat. Will the current system and users receive notification to register? Yes, they will. Do you have a list of the end users to notify? We do have a list, a contact of the users. And for the ones that we may not be aware of, we'll reach out to the providers and find out who those users are we should be contacting. Okay, Akash, can you hear me? I see your hand is up again.
Yes,
go right ahead.
Sorry, I had some technical issue with my headphone. So Gail, my question is more in terms of the connection. So we do have credentials and everything. So should I proceed with the question or we can communicate over email?
Yeah, you can go ahead and ask your question because you have your credentials and you have your endpoint. So you should have your test environment set up so that you can connect by way of that link for the endpoint. And then all you would need is your credentials to begin sending over your VXUs. So
Yeah.
go ahead. What's
So
your question?
So in Athena, we have the messages queued. The only issue we are facing is with the SOAP header. At present, we are not sending the SOAP action parameter over there. So I just wanted to have a request, like if we can get an example or a SOAP that should be working over the email, so that accordingly I can communicate with my development team and they can work on coding the same header, because I think that the rest are same. Everything is looking good. I can share it over email. The SOAP is good, but the header is something that we are not able to send at present, and because of it we are not able to reach out to the HiSIS system.
Okay. What we can do, Maya, I may pull you in on this part of it. Either we can get together on a call with you after this meeting and work through that. And then we can point out exactly what you need for that and then make that available to everyone else and when they get to that point in onboarding. Maya, is there something that you can add to that part for me?
Yeah, that sounds like a good plan. It is not uncommon to have connection issues related to that SOAP header, so we're happy to work with you and get that formatted correctly so you can get that successful connection and messages sent over. So
awesome.
Thank you.
Thank you. So yeah, I'll reach out to you after this call and we'll set up a time for that. Is today a good day for you?
Yep, there are meetings, but I can like postpone them or cancel them as per the availability.
Well, no, you let me know what time is good for you, and then just send me an email on a time, and then we'll schedule it then. And I'll check with Maya on her time too.
Sure, that also works. I will send it over email. Thank you.
Thank you. Any other questions in regards to the process for the onboarding for HL7 messages? I hope I explained everything clearly to make the step process a little clearer to everyone. I know it's kind of somewhat convoluted earlier and everyone is wondering how are we going to do this, but we do have a method to our madness and we're looking forward to making this process as easy as possible. So after going through all the details, it looks like we can do this in 5 easy steps. And once we work out any protocol issues or anything like that, then it should be a smooth transition.
Hi, I had a question. I have a small question. Hi, this is Atish here from eClinical Works.
Okay.
So my question is, do you need, I'm good, thank you. So on the test environment, do you just need those test cases or do you need production data as well to be submitted?
No, just test cases. We're not looking for any PII at this time. No real live data, just test cases only as far as sending over to our quality environment, quality assurance environment. So yeah, just make up first names, use your clinic as the last name, and definitely, fake date of birth, no real live information at all.
Okay. So while we are testing the new endpoint, these practices will continue submitting towards the production environment. That's the current system. So is that how it will work?
Yes, you do want to start preparing your production system also. I mean, still continue with the current process that you're sending over right now to our current legacy system. You want to continue that up until go live. But once we hit the go live of June 16th, we will provide you that same day with a new set of credentials for production and a new link for your endpoint. And then you would just plug those two entities into your preset profile for your production environment, and you should be able to still send over as smoothly as you had been able to in the test environment. So right now, what we're providing you with is the IDs and passwords for the quality assurance test environment and the link that points to that environment. But at the same time, because you're just only sending test data over, you're going to still send your live data to our legacy system. So that's ongoing up until June 16th, which is our go live date. And then
this is
get
only an endpoint URL change, correct? This is only an endpoint URL change. Is there anything else that's changing?
That and then the values that we provided you. So in the, I go back to here, these values that I provided, that must change even in your test environment, because that's why we're presenting this information. You have to set it up with these values. Again, the web IC can be the name of your facility. That's fine if you want to put that there. But these other values are very important. You must have the new IDs that will be provided for you, which is actually your same clinic numbers. It's just, if it's a 4-digit number, you'll put a 0 in front of it. If it's a 5-digit number, then only the high HI will be preceding. So it's the same clinic numbers that you're using right now for the clinic, not the parent. When you think about the new system, forget about the parent numbers, forget about the parent org ID. Only focus on the clinic.
Okay, thank you. That's all from my side.
Thank you. Okay, anyone else have any questions? You got about 3 minutes. Now I can give you the rest of your day back. Let me just check the chat and see if there's any questions in here. Is the only thing changing in the sending? Will the query stay the same? I guess pretty much, yeah. The query will be the same except for the changes that I've identified that you need to look out for. Again, in the communication 3, when you're assigned registry staff assistant, send you that communication number 3, it is completely outlined with all the changes that you will need to change. So here, I'll pull that back over just real quick. It'll include the test cases, but it will include all the changes, configuration values that you need to know. So from changing your MSH4 and just identifying the other areas, definitely the race codes must be in place. So these are the things that you must be aware of when sending or setting up your VXUs.
Has this document been sent to everybody?
If you are not at step 3 at this point, then no, you have not received this document yet.
Okay.
If you may be at step 2. Step 1 was just notifying you about it. Step 2 is the email where our staff is introducing themselves to you and letting you know that I am your assigned person to work with you through this process. And then once your clinics have been validated and we know we have a clean list of what all your clinics are that you're going to send on behalf of, then this document will be sent to you to give you your ID and passwords, to give you the endpoint, and to go over the changes that you need to make within your VXUs. So this is step 3. So you may be at step 2 right now where you're just being introduced to your assigned person. You're on from our DOH staff.
Okay.
So definitely reach out to your assigned person, and our staff will be reaching out to you to make sure that we are covering all the providers and to make sure that we do get each and every person on board as smoothly and quickly in this transition. Okay, do we have any other questions? We're on the top of the hour. If there's no questions, feel free to join us for our 1 o'clock session. If you'd like to review this information again, the same information will be reviewed at 1 p.m. If you do not have that invite, please email in the chat and I'll be happy to send you out the 1 p.m. invite also. Okay, with that, if there's no more questions, please accept our thanks for spending time with us this morning, and we look forward to having a smooth onboarding process with each one of you.
Excuse me, Gail. Hi.
Yes.
I missed the call. I miscalculated the time. I'm calling
no
from
worries.
the East Coast, so and unfortunately, I can't make the later session either. Is this information somewhere where I can access it?
This information that's being provided will be sent out to you by your assigned person who's working with you to bring you on board. Which clinic are you with?
I'm with, okay, please excuse my pronunciation. It's Kokua, Kokua Kalihi Valley CFS.
Okay, give me a second. So CMG, I'm looking at your email address. Okay, I will follow up with you.
Okay.
Hold on. And I will share this with you real quick, just so you guys can see this. These were the list of all the HL7 senders that we have. And these are your assigned persons who will be working with you.
I see my person. Thank you.
Okay. And there's a little more. We do have STC on hold for a moment, but they'll still have their assigned person working with them.
I'm
so
on line 27. That's the clinic I'm onboarding.
Kokua Kalihi Valley. Tom, that's you.
Okay.
Yeah.
All right. All right. Awesome. So each one of you will have your persons working with you. They'll be reaching out to you. And if you don't hear from them by the end of this week, please contact me directly. gail.watkins@doh.hawaii.gov. And let me know, and I will follow up with to make sure that they reach out to you. Okay. So you see how we have the HL7 sender? There's no parents here. We're going straight with the clinics and the clinic's ID numbers. So that's why we say clinics only, no parents. Parents are a legacy now. All right. Well, thank you. I don't want to hold anyone over. If you have other meetings or appointments, if there's no further questions, and again, feel free to reach out to us if you have any questions or reach out to your assigned person. All right. And with that, I'm going to conclude. Everyone have a wonderful day.
Thank you, Gail.
Thank you.
Thank you, Gail.
You're welcome.
Bye.
Thank you. Bye.